everyone, and welcome once again to Healthy Living Central Florida. I'm your host, Gina Horan. So every 40 seconds, I just learned, in the United States, someone has a stroke, and it is one of the leading causes of death and disability. So here to help us break it all down is Dr. Sean Meagher from UF Health. We're going to call you Sean, though. That's your preference, correct?
That sounds great. Thank you.
Okay, so you are hopefully I'm going to get this right, neurointerventional surgeon.
Yeah, it's a mouthful, isn't it?
It is a mouthful. But before we do that, I'm always very curious as to how people sort of get started in their specialty. So let's talk about your background, sort of pre-med, how you decided to go to be a doctor, and then also the specialty.
Okay, well, boy, that's going back a long way.
Isn't it?
So I guess I knew that I wanted to be a physician starting somewhere around the age of 7 or 8. So there are a lot of physicians in my family, and I really liked what they did. I sort of liked the things that I saw. And so, I knew from an early age that I wanted to be a doctor.
You're lucky because a lot of people don't know. So did you have your little stethoscope when you were a kid or just,
no?
No?
It's interesting in the standpoint that I knew, from a young age what I wanted to do. My children, on the other hand, they have absolutely no interest in being a physician after seeing the lifestyle that I've led.
Right. Okay.
And, the commitments that I've had to make. And so watching them sort of figure it out, one of them's 21 and is figuring it out, and one of them's 16 and still is unsure. So it's different than what my experience was as a kid, where I just kind of always knew.
Right.
So obviously I did everything I could in high school and college in order to be able to get into medical school. I'd say my path was not particularly ordinary, and that I majored in English literature. So I think I was like maybe one class shy of a double major in biology. But
so you can recite Jane Austen as you're, basically doing surgery.
More likely Shakespeare,
okay,
but
perfect.
Shakespeare and Chaucer. But it just seemed like that was, in retrospect, it actually wound up being a good idea. But at the time, I was just sort of thought that, well, it's an opportunity for me to do something that I love. I always enjoyed reading and writing, and that gave me the opportunity, because I knew if I'm going to be a physician, I'm not going to be doing this stuff moving forward. And so, as it turns out, actually, it was great preparation for being able to communicate. So baseline, after medical school, I did a radiology residency first. And when you're a radiologist, you're interpreting images and creating reports. And so, really what I learned how to do is communicate verbally and on paper so people can understand what it was that I was talking about. So there's nothing quite like having information that you don't know how to deal with as a physician. And so being able to put it in a way that everybody from patients to subspecialty physicians to general physicians could understand, I think wound up being a real benefit for the background that I chose.
So your bedside manner probably, is nice. You're able to communicate.
It's pretty conversational.
Well, when you have words like neurointerventional and you have to break that down for people, I'm sure that really helps.
It does.
So strokes. Okay. It is very common. I was doing a little homework before, and I know personally it affects a lot of people, and I can talk about myself. So about 2 years ago, my very beloved auntie, she had a stroke at our Christmas party, and we didn't know it for about 24 hours, and she just kind of felt wobbly, and she passed like 2 days later.
Well, I'm sorry.
Thank you. And so then last year, my mom had, I think it's called a TIP, or like a tiny stroke. And so, I was like kind of freaking out. Now I'm worried about her stress and all these things. So there's such a wide, I think, variety, and it does affect a lot of people. Can you just kind of talk about, strokes in general, what's happening, today with people?
Well, there's two types of strokes. There's strokes that come from a blockage in an artery, and then there's strokes that come from bleeding in the brain. So the vast majority of them, maybe about 80-85%, are from a blockage in an artery. That's called an ischemic stroke. About 15% of them then are from some type of bleeding, either in the brain itself or in the spaces around the brain, and that's called a hemorrhagic stroke. Both of them usually present with the acute onset of some kind of neurological symptom. Usually it's on one side of the body rather than both, although it can sometimes be involving both sides.
So is that why sometimes if someone has a stroke, they have like one side of their body is kind of not responding to what oxygen or kind of what, just normal functions?
So the brain is very dependent on oxygen delivery. And so if you block a blood vessel, then what happens is the brain very quickly doesn't get the oxygen supply that it needs in order to carry out its normal function. And cellular mechanisms start to break down very quickly. And those almost immediately result in neurological symptoms. So it can be something that can be very quick.
Yeah, I know that for a fact. So let's talk about neurointerventional surgery and that specialized field and sort of what's happening with that these days.
So probably a good definition for it would be the use of minimally invasive imaging guided techniques to do endovascular surgery for different sorts of things in the neurological system. And by that, I mean the brain, the spine, the spinal cord, and the structures in the face and the head and neck. And so we can use x-rays, we can use ultrasound, we can use different kinds of imaging-based guidance to be able to navigate through blood vessels or directly puncture different things in different parts of the body to be able to alter tissue in ways that hopefully have a meaningful impact for the patient.
So can you talk about the difference between a stroke and an aneurysm? Because I think sometimes people, confuse the two.
So an aneurysm is a type of a stroke.
Okay.
So, when people really ask what neurointerventional surgery is, I think the best explanation is I tell people I'm a plumber for your brain. So if the pipes are leaking, I plug them up. If they're plugged up, I open them up. So I think everybody understands when you put it in that way. And so an aneurysm would be a type of stroke where the blood vessels are leaking. And so for reasons that are not entirely clear, we can sometimes have weaknesses in blood vessels. They tend to occur in relatively typical places. And over time, that weakness can balloon out into something that sort of looks like maybe a little raspberry sticking off a blood vessel. And that's a weak point. And that can cause rupturing and bleeding. And so that's a type of stroke that would be referred to in technical terms as a subarachnoid hemorrhage.
So what is the difference between say genetics and environmental when it comes to strokes? Is there a difference or?
It's all of the above. I mean, there are people who have genetic conditions or inherited conditions that can predispose them to stroke. And then there are things that we can do that can mitigate our risk of stroke, or they could increase our risk of stroke. So if you have diabetes and you don't take care of your blood sugars, that's something that can make you more likely to have a stroke. If you don't take care of blood pressure, if you have elevated blood pressure, that's another thing that can increase your risk of stroke. Not taking care of your lipids, smoking. So there are all sorts of things that work together in concert to either raise or lower somebody's risk of having a stroke.
Well, that's a great place to stop. Sean, Dr. Sean, I don't know, Dr. Meagher, Dr. Sean Meagher with UF Health. When we come back, we're going to talk a little bit more about prevention, what people can do to prevent a stroke, because I'm pretty sure that there's a lot of things we can do.
Yeah, that sounds great. And I'm excited to share that type of information.
Okay, thank you. When we come back, don't go anywhere. We'll be right back with Healthy Living Central Florida and Dr. Sean Meagher of UF Health. Don't go anywhere. Hello, everyone, and welcome back to Healthy Living Central Florida. We're here with Sean, Dr. Sean Meagher of UF Health, and we're talking about strokes and neurointerventional surgery and all the ways that you can sort of help yourself prevent a stroke. But first, I'd like to know what brought you to Central Florida and UF Health in general.
Well, it was a great opportunity. Ultimately, I think that this allowed me to sort of put a stamp on something. So, really there's been a void in high-level stroke care in our community for quite some time. So we do have 2 hospitals in the area. Both of them are primary stroke centers, but there was an opportunity for me to come in and hopefully raise the bar and change healthcare for the entire community and leave sort of a lasting legacy. And that was something I think that I found quite appealing. The hospital had already demonstrated a commitment, or I should say the health system had demonstrated a commitment to improving stroke care down here. And to that end, they had already decided to put in a biplane neurointerventional suite, which is a really fancy and expensive piece of equipment that allows me to do the surgeries that I do. And they also had made the commitment, put the mobile stroke treatment unit here, our MSTU, which is an emergency department on wheels that takes the stroke care to the patients. And so seeing that they had already decided to do these things before I ever even agreed to come, I think demonstrated the level of the commitment of the leadership of our institutions and the healthcare system. And so that drew me to the area as well.
Sean, can you talk a little bit more about UF Health's mobile stroke treatment unit and what it provides?
So the mobile stroke treatment unit is a really exciting program that doesn't affect us just here, but we also have units in Gainesville and Jacksonville. Our unit here in Central Florida just went live about 2 weeks ago, so a little less than 2 weeks ago. So really what that is, it's a very specialized ambulance with high-end equipment in it that brings the emergency department directly to the stroke patient. So through the 911 system, the mobile stroke treatment unit gets dispatched anytime someone calls 911 with symptoms of a stroke. And so they show up with a very highly specialized team of professionals. So there's a paramedic, there's an EMT, there's a nurse, and there's also a CT technologist. This particular ambulance is a little bit larger than usual. You can't miss it. It's huge. It's blue, and it's driving around the area with a big brain on the side.
Okay.
So it should be obvious if and when you see it on the road. And what this does is it allows the stroke treatment to begin right in the field. So our team of professionals will evaluate the patient. There is a system inside that allows telecommunications with a vascular neurologist. At the moment, they're based in Gainesville. And so they bring the patient in, they put them in the middle of the ambulance, they connect with the doctor who then evaluates them. It's got a CT scanner right in the ambulance, and that allows us to identify what kind of stroke they had. Is it a bleeding stroke? We will see that. If it's a bleeding stroke, then that means that that person is not eligible for clot busting medicines. And so that's an important piece. If there is no bleeding and they have these symptoms and the doctors think that they meet the criteria, then we can administer clot busting medicine. Specifically, we use something called TNK directly into the IV in the patient so that hopefully we can interrupt this stroke right in the process. The amazing thing about this is that the vast majority of strokes don't get treatment within 90 minutes. But with this program that we have with the mobile stroke treatment units and essentially bringing the emergency department and bringing the stroke team out into the community directly where that patient is, we now have more than, I want to say 50% of our patients that we evaluate who are eligible to get the medicines are getting that. So that's an enormous difference. And when you think about what happens in stroke, so every minute that there's blockage of an artery and a lack of supply of oxygen and sugar to the brain, the brain loses about 2 million brain cells. So if we can knock 50, 60, 70 minutes off of a treatment, then we're directly impacting what somebody's neurological outcome could be. So it's an extremely exciting program. We're the only institution in the state of Florida that has a fleet of these. And so it's been addressed largely as a health need for the state, as opposed to just sort of doing a one-off, one mobile stroke treatment unit here. But we have the largest fleet in the state of Florida.
That is so exciting. And when you talked about the blue van with the brain and the fleet, I'm picturing all kinds of wonderful experts and a great team inside that van. Talk about the team that you've, met and work with now at UF Health and how much that's meant to you.
They're all highly personable people. They like to have a lot of fun. They're very dedicated professionals, and they're all passionate about stroke. We couldn't have assembled a better team to take care of you while you're having a moment of need. And so it's been a really exciting opportunity to see this, to have worked on it in the background for the last year, to see everything come together and now see it rolling around the community, taking care of patients. And I want to say that we've already taken care of at least one person who got the clot busting medicine delivered to them right out in the field. So it's already directly impacted somebody's life.
Well, I'm convinced. Can you talk about how the aging population here has an impact on stroke care? Does it matter? Is there an age where people...
Anybody can have a stroke. I mean, I've taken care of newborn infants all the way up to, people in, their hundreds. And so it can happen to anybody. Just because you're young doesn't mean you won't have a stroke, but it certainly is a little bit more likely the older that you get.
Mm-hmm. That's new information, because I really feel like everybody thinks, if you have to be over 60 and have all these factors to have a stroke, but it can happen at any age. Is that true?
It can happen at any age.
Yeah. So let's talk about prevention for a second. And I'm going to circle back. I always circle back to my mom because she did have a small stroke last year. And so I feel like I'm monitoring her all the time, but I feel like I'm adding to her stress by doing it. So what are some of the things that we can do to prevent a stroke, especially if someone has already had one?
Well, I would say the most important thing is changing any bad habits that you might have. So first and foremost, stroke the risk is significantly elevated by smoking.
Okay,
so if somebody is a smoker, and I know that if they've been a lifetime smoker, that can be a real difficult thing to just turn away from and stop. But that's probably one of the biggest things that somebody can do is cessation of smoking. And then really it's just taking care of yourself. So the basic sorts of things: eating well, being active, taking care of your body, exercising a little bit, getting up, moving, walking around, not leading a sedentary lifestyle. So really that's the most important thing, really, is just general health related types of things. And if you do have problems, diabetes, high blood pressure, elevated lipids, making sure you take care of those.
And so diet, I would imagine, is a pretty big up there then. I mean, no?
Certainly yes, with, part of healthy living. I would say personally, I'm a vegetarian and I have been for almost 30 years now. And so just eating well has good benefits to your health in general, one of which is improving your risk of cardiovascular events.
So you're also a mentor and an educator. What would you say to up and coming doctors or anybody that's, in med school thinking about going into medical as a career? You look a little cynical over there, Sean.
Yeah, it's a very difficult field to be a part of. So many people just tell you, oh, this is the greatest thing. And don't get me wrong, there is an enormous amount of satisfaction that's derived from helping people, but it comes at a cost. And I guess I generally tend to be the person that points out this is not all, roses, and you need to think about what this is going to be like for your life, what you want to do, how you want to do it. And then if you decide that this is the kind of lifestyle that you want to have, thinking about, well, what are you going to do that you feel like suits the type of personality that you have, what your interests are, because ultimately you have to decide what you're going to do inside of medicine. And the person looking at you in the mirror every day.
Is it a lot of time dedication, or, I mean?
It's enormous. It takes over virtually every aspect of your life.
That's a lot of life.
Yeah.
I see. Okay. So, Young Sean is 7 again and are also back in college. Do you want to teach Shakespeare this time, or do you want to write screenplays?
I tell young Sean to work on Wall Street.
Okay, well, fair enough. So aside from being a dad of kids who don't know what they want to do, although you did just say that your son, you wanted to go into something different lately, and also being a vegetarian, do you have any other fun hobbies? Does Central Florida provide you with...
Well, I have things that I like to do, but what I do is pretty invasive in terms of the kind of activities that I can participate in. And I knew this going into it. So I full well understood the commitments that I was making. So by and large, I'm never more than 15 to 20 minutes away from the hospital. I'm on call at the moment every day for emergency procedures. And so obviously that's going to impact what I can do, where I can do it, and how I live my life.
Well, can you tell our audience where your hospital is? Where are you practicing right now?
So we have 2 hospitals with UF Health here in the area. There is the Villages Hospital, now renamed Spanish Plains Hospital, up in Sumter County in the Villages. And then here in Leesburg, we have UF Health Leesburg Hospital. Primarily, my practice is focused out of Leesburg, but I do also spend some time at the Spanish Plains site as well.
I may have seen you in the hallways when I brought my mom in last year. So I'm glad you're there. I'm glad you're there for all of us. Can you talk a little bit more about how UF Health is really helping your department?
They've made an enormous commitment to stroke care across the entire spectrum of UF Health, not just here in Central Florida, but also in Gainesville and also in Jacksonville. So we have a very robust cerebrovascular service between us here in the Leesburg and Villages community, Gainesville and Jacksonville. And we're educating the physicians of the future. So we have neurology and neurosurgery residencies. And we're really working very hard to address the neurological care needs of the entire state of Florida. And realistically, hopefully the entire Southeast.
All right. Well, Sean, it was wonderful to meet you and great to talk to you. Thank you so much for all of your insight, and have fun with your kids and your vegetarian lifestyle outside of work. And we appreciate you being here today.
Thank you very much. It's my pleasure.
All right. That'll do it for another edition of Healthy Living Central Florida. We'll see you next time.